the young mothers were not even registered on SHA because of various reasons. They have stated, for instance, that some of them lack IDs. At a time when we are being told that even areas that hitherto had difficulties obtaining IDs, Speaker, that they have been expedited. This was the theme at the recent Madaraka Day celebrations in Wajir. So how is it possible that our young mothers in Kiambu are not able to access IDs so that they can register on SHA? I have seen a good recommendation from the committee there that we should find a way, SHA should find a way of registering these young mothers, even as government processes their registration documents, so that they are able to access this facility. Speaker, our Committee of Health also reported that they were denied access to data on child mortality in some of these facilities. And I don't understand why a committee of this House can be denied access to data, because we have heard separately that some of these counties and some of these facilities are actually understating the number of children who are dying after birth, Honorable Speaker. And we as a committee or as a House should put our foot down and say we need access to that data, Honorable Speaker, so that we can make proper recommendations to help these facilities. Honorable Speaker, there's also the challenge of SHA reimbursements. And, you know, this is the reason why I say it is good for us to visit these facilities and to see for ourselves and to speak to our people. Because when you hear senior government officials speak, and we were in Naivasha with CS Duale, he will tell you that SHA is working 100%. Speaker, just reading through that report, you will see that this challenge is across counties. And I will continue to insist, Speaker, that the promise that the President made was for free universal health care access across the board. And that was a promise that was made to Kenyans when we were being persuaded that those of us who earn a bit more should pay more than what we used to pay at that particular point in time, so that, Honorable Speaker, those who are not able to pay will no longer, will no longer suffer the indignity of having no access to health care. In fact, there was a statement that the head of state made recently, Honorable Speaker, that the Harambes that we used to hold, the WhatsApp groups for contributions to support health care, have been closed down. I don't know where the head of state gets this information, Honorable Speaker. Just yesterday, I was trying to call the director at the CEO of the Kenyatta University Teaching and Referral Hospital. Because, Honorable Speaker, there is a friend of mine who passed away. He was one of the clergy at the ADC church in Runda. And when he passed away, Honorable Speaker, there was a bill of almost 1 million shillings. And the hospital, and I don't know why, they have refused to release the body. Even after the family has pleaded with them, we have written letters, we have made down payments, we have agreed to a payment plan. Speaker, out of that 1 million shillings, SHA only paid 300. So I want the President to know that we are still contributing money to get our people health care. It is the reality on the ground. And you can see, Honorable Speaker, that even the report of the committee is saying even the facilities themselves are struggling because SHA is not giving the reimbursements in good time. And this is true at Mama Lucy Hospital. We have a debt that is owed to Mama Lucy and all the other facilities here in Nairobi, and we're being told the same is the situation in Kitui, the same is the situation in other places like Kiambu. Honorable Speaker, there is still unresolved issues of NHIF, and the report also addresses this, that there's almost 5 million shillings that is owed to Kiambu Hospital. I think the teaching and not the teaching, the Kiambu Level 5 Hospital from the old NHIF. I don't remember which month we were in Naivasha with the CS, but I remember him giving us some timelines within which the question of the legacy debts of NHIF would be resolved. I think as a House we need to bring him back here, because there was reports that he was supposed to give us on what the ministry is doing to address those legacy debts. I have seen complaints about the quality of food in inpatient wards, Honorable Speaker. They have complained about the quality, the portions, even unhygienic presentations, and one that is quite hilarious that the committee noted, or they were told that the food doesn't even have salt, Honorable Speaker. by the time we are discussing salt in food, there's a big problem there, Honorable Speaker, which is why we must continue to insist that counties be given their monies in time and in accordance with the Constitution for them to be able to undertake these devolved functions. The only ray of light, Honorable Speaker, I've seen is at page 29 of that report. For the first time, I'm seeing that at Kiambu Referral Hospital, that they had a properly stocked pharmacy, that there were actually drugs at Kiambu Referral Hospital. They were well stored, well managed with proper records. And these are the few things that when we see, we feel happy and we celebrate that at least somebody down there is doing something. Because when we visited the hospital in Busia, Honorable Speaker, when we were doing Senate Mashinani, you could see when you are approaching the hospital there is a row on your right of private chemists all along that road. And it is always a first indicator that there's a problem in that hospital. That somehow the systems in the public facility is such that you ensure you can guarantee business for the private pharmacies outside. So I am happy that at least that is not happening in Kiambu Referral Hospital. According to the report of the committee, they have said they also saw digital X-ray that is serving almost 100 people per day. It is suspended on the ceiling, and I've seen the photos there. They also reported that Karuri Health Center, Honorable Speaker, is one of the most well-managed facilities they have seen. They have digitized their systems. So we will give Kiambu their flowers for the things that they are doing and maybe encourage other things, other counties to also follow suit. The story of mortuaries is the same across the country. When we were in Busia, same problem. The same mortuary that Busia has had since independence, Honorable Speaker, up to today, and is in a bad state. Dilapidated mortuaries is a theme across the report. And Honorable Speaker, we continue to reiterate that something has to be done. And when you look at the totality of all of this, Speaker, and then you ask ourselves, is it really true, Honorable Speaker, that our state of healthcare is such that we could be able to deal with any medical emergency in this country? The report paints a different picture. And this is why when Senator for Kitui Wambua was submitting, he said that the concerns that Kenyans are raising about this Ebola facility in Nanyuki is actually a valid concern. We have proposed to the President that instead of us transferring patients from DRC to come and receive treatment here, I think that the US government should grow the capacity of the DRC itself to ensure that that disease does not leave the borders of the DRC. And all of us will be safe, Honorable Speaker. If the money that has been pledged towards this project is given to President Tshisekedi, he should be given that money for him to be able to put up those centers there and be able to contain Ebola within their borders, although now we are hearing reports of even deaths in Uganda, Honorable Speaker. So the state of our healthcare is quite dire, and contrary to what people speak of here in Nairobi and in other public gatherings, they paint a very rosy picture. But the committees of this House, when they go on the ground, the situation that they find, Honorable Speaker, reads like a nightmare, and you can all see in this report. So with those many remarks, I want to thank the Committee on Health, led by the Senator for Uasin Gishu, Jackson Mandago, for this very well-detailed report. They have highlighted challenges. They have highlighted things that they feel need improvement. They have given flowers where they are due, Honorable Speaker, as the case in Kiambu Referral Hospital with their drugs or their pharmacy, and given proper recommendations here. And I think and I hope that once we adopt this report, some of these recommendations will be taken into account and implemented so that we can give our people assurance that the quality of healthcare in this country is as portrayed by some of the leadership in this country. Thank you, Honorable Speaker.
Senator Sigei.
Thank you, Mr. Speaker, for giving me the opportunity to also contribute to the various reports that the Health Committee have submitted before this House. Mr. Speaker, I would like to start by commenting the committee for the well-done report. Particularly, and of great importance, is the fact that they did indeed had an experience that is reflected in the reports from the various hospitals, dispensaries of the various counties that these three reports have been reported from. And indeed, Mr. Speaker, part of what we have as a House and as various members of other respective committees, we have seen and appreciated the presence of various committees on physical ground or in specific places where we are undertaking our oversight role. Unlike where we are doing it in the chamber or here in Nairobi. Mr. Speaker, presence in our respective counties, presence in our respective hospitals where we are conducting that particular oversight, Mr. Speaker, gives us the exact situation, and therefore, as at the time of coming up with the report and the recommendations, we are doing it with first-hand information. Reading through some of these reports, Mr. Speaker, reflects a scary situation. There is outright deterioration of health facilities, not only in the counties that we have been provided for by the committee on the basis of their visits to those counties, but it is a challenge that cuts across almost all the counties in the country. And, Mr. Speaker, it reflects on the situation of our health facilities, reflects on the kind of service delivery that the electorate naturally would expect from the county governments, and also reflects on the ultimate service delivery to the people of Kenya. Mr. Speaker, the recommendations that have been given are almost similar across all the counties which have been visited, and as I've said, reflects equally on the rest of the counties. One of the major issues that have been identified, and which is a glaring challenge on administration of the county government managed hospitals, Mr. Speaker, is the capacity of those hospitals. You find that one bed is shared, as we've been told, by more than 3 patients, whether these are mothers who are on their maternity or even patients who've got various ailments. It is impossible to say to get appropriate medical attention when you have got 2 or 3 people sharing one bed. That situation, Mr. Speaker, is common among most of the hospitals where the committee visited, and it is equally reflected in even our various other hospitals where the committee did not. I recall, Mr. Speaker, previously the same committee made a visit to Longisa Referral Water in the hospital. You can imagine, Mr. Speaker, a hospital facility with no tap water. It is absolutely disheartening to see patients going out of the facility, getting water from water vendors outside, or even sending, in most cases, like in this case, Mr. Speaker, in Longisa Hospital, I am aware that border riders have now made good business out of water supply to the hospital. They only step out, get their 20-liter mitungis and line up along the road in order to supply water to patients who are in hospitals. This situation is serious, and when you look at the report, it can only be appropriately dealt with if our county governments have proper governance, because from the various Senate audit reports, part of the challenge is improper governance. Resources are abused. Resources are directed to non-essential services, and in most cases also, those resources are entirely abused by those who are governing those institutions. Besides the challenge on the bed capacity, where patients are sharing beds, there is also, Mr. Speaker, an availability of essential drugs. This has also been reflected in these reports and is cutting across almost all our institutions of health, which are mostly managed by our county governments. And Mr. Speaker, this one is one of those issues where, as some of the members have spoken to here, you find that the pharmacies within the hospital have got no essential drugs, but there is, just outside that particular institution, a lineup of private-owned pharmacies where those essential drugs are available. And what happens within the hospital is that patients are given prescriptions and are asked to go and buy for themselves, such that even if a patient was unable to have the financial capacity to purchase and therefore relying on the social health care facility, that's the SHIF, they will be forced to find a way of making sure that they get the drugs from those private pharmacists. And it is one way of, Mr. Speaker, making sure that the drugs which are normally available in hospitals, we are told in some places we don't have drugs in the hospital, but are normally stolen or are sold out to private practitioners who now make money out of it. And that is a problem on governance. It has been identified in these reports that one of the challenges that most of these institutions from the various hospitals that were visited by the committee is that there is improper governance where no one takes responsibility. The hospital superintendent is not available or is not qualified. Doctors, nurses, clinical officers are not paid in time, and therefore their availability to even be present as and when they are required is, in most cases, discouraged because their services are not paid for in good time, and their working condition, definitely, Mr. Speaker, is compromised. And therefore, if we as a committee, as a house, were to enhance direct and presence in almost all our institutions in the course of our oversight, there is a high likelihood that there will be an improved performance, because being present is not the same as where we are doing oversight at the level where we are in Nairobi, or when we do not have presence in those particular institutions. Another issue that has been identified in these reports, Mr. Speaker, which is also common across, is those health service promoters who, although they are not necessarily under the full obligation of the county governments, they are very essential, and they are the first line of presence in our various areas of representation, because they are the ones who will directly be reaching out to patients. They know almost every other family that has got a patient, and they will be the people who will support in terms of giving directions on what kind of medical attention such people require. And it is, Mr. Speaker, very unfortunate that they are not being paid their stipend. And if they are paid, sometimes they are paid when it's delayed. And therefore, it compromises entirely the service delivery from their part and spills over now to the institutions, the health institutions where they are supposed to report to, or where they are supposed to take the patients in. And sometimes also where they know, after all, even if they were to push themselves to support, there will be no attention relevant to the patient in their health institutions, because poor governance is present, or no drugs, or at some places, Mr. Speaker, they are literally not even operational. And therefore, the decision that this committee did, together with the rest of the committees, including Education Committee and all other committees, by making their presence felt in the various counties, the role that they're supposed to do will entirely support the people who we are supposed to help as the oversight role. And so, Mr. Speaker, as we appreciate the work of this committee, we'd like to encourage them also to make sure that they enhance their visits and make sure that the recommendations that have been made by the committee on the various institutions are followed through, so that some which are possibly able to be implemented should be implemented. Those which are not, of course, will form a basis of future follow-ups by the relevant committees. And Mr. Speaker, I stand to support this report. Thank you.
Senator Siango.
Thank you, Mr. Speaker, for giving me this opportunity also to add my voice on the report by the Committee on Health. Mr. Speaker, sir, the report touches on Kitui and other counties, and I noted with concern specifically on the matters of the care for mothers and children. Mr. Speaker, when patients are sharing same bed, about 6 patients, and some with newborn babies, it is so unfortunate because babies are sensitive, newborn babies are very sensitive. They can contract infections very easily. And when they are forced to share a bed with their mothers and other strangers, they may contract diseases, and that will lead to death. This is very sensitive. I really appreciate the Committee on Health because of these visits that exposed some of these evils that are happening in our counties and in the hospitals. Mr. Speaker, specifically speaking to Kitui Hospital, my attention was caught by what the superintendent, the medical superintendent, has done. He has appointed or engaged a pharmacist who did a short course of 3 months on echocardiogram. And she is the one now handling patients with cardiac issues. This is putting the lives of my people in Kitui in danger. The hospital should have an experienced, qualified person who takes care of patients who come and visit the hospital when they have heart diseases. But to be treated by somebody whose training is not on the issue of cardiac issues is very, very dangerous, and it is endangering my people of Kitui County. Mr. Speaker, those things were unearthed when the committee visited the hospital. It is serious, Mr. Speaker, when we engage people and then we don't appreciate their services. I'm saying this concerning the CHVs, whose stipends are delayed, not paid in time, and even themselves, their health is also wanting because they are not assured of insurance themselves. They work, visiting house to house, door to door, supporting our people. And when their stipends are not paid in good time, they have obligations because these are people who have families and they are looking for a way also to survive, if not to live. And when their stipends are delayed and sometimes not paid for several months, they suffer. Mr. Speaker, I would urge the counties as well as the national government, because they share the payment of the stipends, just to hasten the payment and do it in good time. My attention, Mr. Speaker, was also drawn to the situation in our hospitals on electricity. Some hospitals have huge bills with the KPLC, and when they don't pay, maybe electricity could be disconnected. And sometimes, even the situation in the hospitals, the electricity is not constant. Sometimes it goes off. and the electricity power may go off when a patient is on the operation table. What does that mean? It means that a life can be lost. Mr. Speaker, it is very important to ensure that our hospitals are constantly connected to power or to electricity. As some of the governors appear before our committees, Mr. Speaker, we also find out that many do not have disposal framework of expired drugs. They are stocked in the pharmacy, they are expired, and I wonder why drugs with a near expiry date are given to our hospitals or distributed. And this also endangers the lives of our people. Mr. Speaker, as some of my colleagues have already indicated, many of the pharmacies in our hospitals do not have critical drugs or very important and common needed drugs. And when they are not there, then they are directed to go out. Sometime when we went around, Mr. Speaker, I noted something very interesting, that near every public hospital, there are so many chemists, private pharmacies. And when people lack drugs in the hospital, then they are directed to go just outside the gate and buy from there. And some are owned by medics who work in those hospitals, and they stock the medicine that is needed, and so they direct people to go and buy from their own private clinics or pharmacies. I think, Mr. Speaker, sir, we need to have serious follow-up on what happens in our hospitals so that we ensure our people, Kenyans, are secure. And there are right policies that are followed to ensure that people are served in these hospitals and they feel secure. I want to thank the President of the Republic of Kenya. He is doing very well. The other day, Mr. Speaker, I watched when they were launching the Ewene program, that mother and the child to be taken care of. This is very encouraging, Mr. Speaker. And we should be people who can see good things and say they are good and we are heading to the right direction. I congratulate the President and the Cabinet Secretary for Health because they have taken efforts to make sure no mother would lose life when giving life to the world. With this, Mr. Speaker, I submit and support the report of the committee. Thank you.
Senator Wamatinga.
Thank you very much, Mr. Speaker, sir, for also giving me the opportunity to add my voice to this job well done by the Committee of Health. Mr. Speaker, sir, I'll start by picking it from the positive note, Mr. Speaker, that indeed the presence of the committee in various counties has highlighted some issues very worrying indeed, lack and shortage of infrastructure, bad services, Mr. Speaker. But I also want to commend the committee because they've given commendations and they've given good remarks on where they found that the hospitals are working well, Mr. Speaker. Indeed, Mr. Speaker, the challenge of health infrastructure in our country has been left unattended the last 62 years. It would actually we would not be doing justice to the current administration, Mr. Speaker, if we don't say that the effort made by none other than the President of the Republic to make universal health accessible, affordable at any part of the country is a very commendable, to say the least. Mr. Speaker, sir, we recall during our independence days that one of the commitments that the the founding father of the president said was to fight illiteracy, poverty, and indeed improve health by making health accessible to everybody. Mr. Speaker, over time, the population has kept on growing. The infrastructure in the hospitals have continued to degenerate. Up until the calendar regime, Mr. Speaker, where the president took very, very unpopular decision, but the right move to make universal health accessible. Mr. Speaker, today, as we stand here, it is not and it cannot be denied by anybody, especially those in the leadership position, that the Harambes in aid of patients have always been a campaign tool, Mr. Speaker. We've been included in WhatsApp groups, Mr. Speaker, and we must admit that these WhatsApp groups have reduced in number. The commitments and the Harambes that are taking place have reduced in number. There are still some cases, Mr. Speaker, and some of them, Mr. Speaker, can be traced back to corrupt administration in hospitals that are highly compromised, doctors that are willing and have always practiced an ethical behavior by charging operations that they've not committed. This, Mr. Speaker, if we are able to address that, and I think that is an issue that have been left severely, if we are able to address that, Mr. Speaker, among other issues, then we'll see the health system in Kenya work. And I think this is a job for everybody, Mr. Speaker. Having said that, Mr. Speaker, there is still a lot that needs to be done in terms of training, in terms of capacity building, in terms of equipping our hospitals, Mr. Speaker. But I think the approach by the government to make sure that CHA is working so that the health system can become a bankable facility where people can go and be able to offer some of these advanced machines, Mr. Speaker, so that we stop sending all our patients to foreign countries for treatment. If we are able to make CHA work in the sense that we can be able to attract investors to come and bring these equipments in our hospitals, then, Mr. Speaker, we will see it work. If we encourage and make sure that we standardize the charges of the drugs and make sure that we also encourage chemists to be established within the establishment so that they can be able to provide these medicines to the people, then we'll see it work, Mr. Speaker. But this cannot be done overnight. What we have been able to achieve in the last 3 years, Mr. Speaker, we must admit that the last 60 years, it has been impossible because the administrations then were not prepared to take the bull by its horn. They were not prepared to make unpopular decisions because they wanted to ensure that they are re-elected. And I must commend the President, Mr. Speaker, because some of these decisions, as unpopular as they are the right decisions that we ought to have made 60 years ago, Mr. Speaker. And this is the time, Mr. Speaker, that we must say, leadership is not about getting re-elected, Mr. Speaker. Leadership is about making the right decision. When the history of this country is written, even when maybe we are not around, it will say, yes, the President did the right thing to do to implement some of these measures. It is our responsibility, Mr. Speaker, as leaders to ensure that we address the issues of corruption in the health institutions, we address the issues of corruption within the professionals, and most important, Mr. Speaker, the ethical behavior of the doctors that we know has also compromised our ability to offer the services. Having said that, Mr. Speaker, it will also be good to say that there are some of the challenges we have in hospital that are caused by mismanagement of those institutions, administrative mismanagement. There are some that are caused by the county governments not being able to facilitate. And I like the fact that the committee did say that they found one hospital in Thika that had a well-equipped pharmacy. This, Mr. Speaker, is a clear indication that if the governors, if the administration around the hospitals were ethical enough, then we'll be able to face this, to overcome this challenge. However, Mr. Speaker, I would also want to advocate for the fact that we need, Mr. Speaker, to devote more funds to the health center as we also create avenues and IT-based administrative tools so that we are able to address the issues around corruption, the issues around mismanagement, and most important, Mr. Speaker, be able to trace the data of the patients so that we can be having a predictable situation where we would know in a couple of years to come, these are the kind and the category of medication that we'll be using, the kind of equipment we're using. And in today's age, Mr. Speaker, where AI enables that kind of projection, forward-looking, Mr. Speaker, is something that we should do. Mr. Speaker, having said that, The issue of CHPs, Mr. Speaker, I must also commend the government, because as much as the spending they are getting is little, as has been alluded by one of my colleague here, we must look at a way of enhancing that, Mr. Speaker, not only in terms of the money they get, but also in terms of the facilities that they get, Mr. Speaker. Things like umbrellas, things like the clothing. We need to give them protective wear so that, Mr. Speaker, as they are going to see these patients, they do not also contract the diseases that they have. Mr. Speaker, I have made it my duty to go around the 30 wards in Nyeri County, speaking to the CHPs, and I've seen the commendable job that they've been doing. And indeed, Mr. Speaker, I must say that the spend from the government, national government, comes promptly, but that from the county government comes little. However, Mr. Speaker, that is a little amount, and we must look at a way of enhancing that so that we can be able to address some of the issues right at the source before they escalate to become major diseases, Mr. Speaker. Improvement of primary health care, Mr. Speaker, should be a priority to every county government. It should be a priority to the national government, and it should be a priority to every leader, Mr. Speaker. And that can be done, Mr. Speaker, by ensuring that we enhance the services offered by the CHPs. But as we're doing that, Mr. Speaker, we must also find a way of capacity building them, Mr. Speaker, so that now we have people who are able to not only to deliver professional services, but also to be able to give timely services by increasing the gadgets they have. And most importantly, the reporting tools that they are using, Mr. Speaker, must be modernized so that we are able to harness that data, harvest it, Mr. Speaker, and use it in our budget-making process so that we do a budget that is data-driven as opposed to the look and feel, Mr. Speaker. Mr. Speaker, it is also very, very important to say that some of the challenges that we are facing in the health sectors are led by the unscrupulous minded administrators who look at opportunity of making businesses out of this, Mr. Speaker. We know it is possible, and it has been done in other countries, Mr. Speaker. We can achieve it in this country. And what we need to do, Mr. Speaker, is to do a evaluation of what we are doing, standardization, and we create standard operating manuals and procedures within all the hospitals so that, Mr. Speaker, we can have a unified approach into how we deal with medical issues, Mr. Speaker. Lastly, Mr. Speaker, as I wind up, indeed, I would want also to end up by commending His Excellency the President, because SHA has ensured that some of the services that has remained inaccessible to some communities is now accessible. However, Mr. Speaker, we must look at a possibility of ensuring that these counties that are marginalized, Mr. Speaker, that they get modernized hospitals. Mr. Speaker, the approach should be to run all the facilities within our hospitals in a bankable way, Mr. Speaker, in a manner that we are able to encourage and to invite and give initiatives to investors so that they can come and install their machines so that we can reduce the amount of patients, the number of patients that we have to export to foreign countries for advanced treatment. Mr. Speaker, with the advent of cyber medicine, Mr. Speaker, it is possible to have collaboration between local hospitals and international hospitals. What we need, Mr. Speaker, is only to standardize the equipment that we are using, and this can be done when we do have a kind of a public-private partnership within our hospitals that will encourage even those international companies to come and invest in our health systems and making Kenya also a medical tourist destination. And that can happen, Mr. Speaker, if we modernize our facilities and if we go in tandem with the modern technology. Mr. Speaker, having said that, let me take this opportunity to thank the committee for the job well done. How I wish that they would do that more frequently so that their presence and our presence as the oversights can be felt within the county governments, within the county, the grassroots facilities. But most important, Mr. Speaker, I think we have an obligation to ensure that we give civic education to our people so that they get themselves enrolled in SHA, so that they get the services that are offered. Thank you, Mr. Speaker. I do commend the committee.
Senator Dulo.
Thank you, Mr. Speaker, for this opportunity. And to contribute to this report of Health Committee of the House. Mr. Speaker, I wish to take this opportunity to thank the committee for having comprehensively outlined the issues affecting our hospitals across the board. Mr. Speaker, right to health is paramount. But unfortunately, in as much as the government at the national level is doing, there is literally very little that is happening at our county levels. Mr. Speaker, patients are really suffering in our hospitals. And if I may start with my own county, yesterday, all the doctors put down their tools. And KPDMU actually advised the county government to have a sitting with them and iron out the issues affecting the doctors in Isiolo County. But surprisingly, they are unable to get the governor of the county of Isiolo to sit down with them to listen to their grievances. And Mr. Speaker, if the doctors themselves are not taken care of, if the doctors are not getting their salaries, if the doctors are not actually covered themselves as far as SHA is concerned, there is no way that they will take care of those patients, Mr. Speaker. And I think if I was actually asked, in as much as devolution, health is devolved, Mr. Speaker, I wish health should be returned back to the national government because the situation is very bad. Mr. Speaker, service delivery. In the report, you will see that actually most of the infrastructures are dilapidated. And that is the serious situation across the board. And if you look at the budget actually within the county government, you will see that the chunk of the budget of the county government goes to health. But that budget doesn't actually even reach the hospital, Mr. Speaker. Many of the hospitals, and a very good example is of Isiolo, the hospitals are dependent on FIF. Nobody knows where the budget is going, Mr. Speaker. Because if the hospital collects about 2 million, and the requirement of the hospital is almost 2 billion, how will they cover those costs, Mr. Speaker? There is a very serious situation that is happening in our counties, Mr. Speaker. I saw KPDMU actually telling Isiolo people yesterday, go to the hospital and collect your patients from the hospital because the doctors are not going to be there. That is a very serious situation. And I think maybe Senator for Meru should also look at that clip because Meru was also mentioned. And the patients are told, Isiolo community were told, go to Laikipia or Tharaka Nithi for service delivery. Doctors are not going to be there. It's a very serious and pathetic situation, Mr. Speaker. Mr. Speaker, the issues of promotion, Mr. Speaker, in the counties, as far as the doctors are concerned, nurses, clinical officers, they are all politically driven. If you are not aligned to the current regime, Mr. Speaker, and those are one of the grievances raised by the doctors, you will not be promoted. Mr. Speaker, doctors and nurses, they don't have tools, they don't have gloves, they don't have masks, and I wonder what they are going to do in those hospitals if they are not properly equipped and even protected. You can imagine SHA is there, but the doctors themselves, they are not covered. Nurses are not covered. The county government staff, they are not covered medically. How will they serve those patients, Mr. Speaker? It's a very serious situation, Mr. Speaker. You will see that the revenue is being collected at the county level. And the manner in which the revenue is collected, Mr. Speaker, you pay cash and it is not actually automated. Casuals have been actually going without salary for almost 2 years. And they are the people who actually do the dirty job in those hospitals, especially cleaning the blood in those hospitals. Patients who are very sick, they're the ones who take care of them. How will those staff, especially the casuals, and I think as a Senate, we really need to deal with the issues of casuals in the county government, because you cannot expect a casual who is earning 15,000 or 17,000 to stay without salary for 2 years or a year plus, and you expect that particular staff to perform his or her work. And we are just quiet. Mr. Speaker, I do appreciate what actually the committee has done. And you can imagine, Mr. Speaker, like a staff of Isiolo County, for the last 3 months, they have gone without salary. 3 months, Mr. Speaker. Some of them, they live in rental houses. And the tenants are saying, if you work for the county government of Isiolo, we are not going to give you a house. You better look for a house elsewhere. Share contribution is not actually remitted for the staff, Mr. Speaker. They have taken loans, Mr. Speaker. Those loans are not paid in time. Promotion is not coming. And actually, some of the doctors are forced to even go out and work outside. And the work of the hospital is left to the students who are in KMTC. Today, we have so many cases of actually maternity negligence, where mothers are actually dying at the delivery table. Mr. Speaker, in as much as we say that a lot is being done, our people are really suffering. Dispensaries in those counties, they have no drugs, they have no equipments, and the distances, Mr. Speaker, especially in case of emergency, those patients travel on a rough road, which is over 200 kilometers. And especially the mothers who have complication, they do die before even they reach where they are being taken care of. Mr. Speaker, this is a very good report, and I think this is affecting most of the counties across the board. Senator Wambua talked about CHVs. In Kenya today, how can you pay somebody 2,500 for a month? That is even below the labor law standard. If we really want to keep the CHVs, Mr. Speaker, we need to formalize that particular structure. We need to actually facilitate them, because these are the people who walk around from one place to the other to take care of patients, to report emergencies. Mr. Speaker, CHVs are really suffering. If we don't want to take care of them, Mr. Speaker, they should be actually left alone. Why do you give somebody 2,500? Because today, if I walk to even any of the supermarkets in this country, with 2,500, I can buy nothing, Mr. Speaker. It's really embarrassing to this particular country. Mr. Speaker, I said earlier, and I will say today and tomorrow, that the health care system in Kenya is not doing the best. The standard that is kept in those hospitals, because I remember when CS Health came here, I asked him who is supposed to take care of the standards within the county government. And he said, us, the national government. But those standards are not kept. You can imagine even promotion. Sometimes people are promoted when they don't even have qualification for those particular positions, Mr. Speaker. How will they manage those hospitals? How will they manage revenue? How will they manage patients, Mr. Speaker? So the issue of standard, and I've been along in this Senate, we have actually said several times the standards of the hospitals in those counties should be with the national government. And I think national government is also running away from that responsibility because they are saying they will not micromanage governors within those counties. Medical equipments that were there, the mess, those equipments were really helping Kenyans, especially the dialysis machines. And if you go and check in some of the hospitals, those dialysis machines, most of them, they are obsolete, Mr. Speaker. Patients are suffering. Cancer patients, they are really struggling. And Mr. Speaker, if I was asked, I will even say SHA should be paid for all the citizens in those counties. The county government should pay actually SHA for citizens. They don't have to suffer. If medical services or medical care is free, why can't we allow county governments to pay SHA for their citizens, where they'll be able to get service delivery? Mr. Speaker, this is a very good report because it's really hurting. National government is doing a lot, but at the county level, I'm sorry to say, things are really wanting, Mr. Speaker. The standard of actually theaters, I remember 3 weeks ago, in my own county, the theater was not functioning because it had a problem. What will people do? Where will they run to? The staff are demoralized. There are no drugs, essential drugs, even paracetamols, leave alone anything. Mr. Speaker, let me stop here, but I will request that as a Senate, we should not actually put these reports in archives. We should follow up to make sure that the recommendation of the committee has been implemented. Mr. Speaker, the oversight institutions that are supposed to look at these issues that are affecting our people in the counties, they should wake up and actually deal with the mess within those health facilities in our country. And I wish to support the report. I thank you, Mr. Speaker.
Senator Mulgo, Julius Mulgo. Thank you very much, Mr. Speaker, for allowing me to also add my thoughts to those of my colleagues. This is a very good report, very elaborate, and I think it a lot needs a way of implementation so that what they have recommended is implemented. When looking at this report and think practically about what is going on in the counties, mine included, I think there is lack of work morality on the side of governors. The governors either do not understand their responsibility or what they are supposed to do and end up doing other things that are not helping the citizens. For example, there is a lot of diversion of health budget that it goes to do some other things apart from what the money is supposed to be doing. It is supposed to be buying drugs, they are not doing that. It is supposed to be paying doctors and nurses and even those who are casuals, they are not doing that. And so nearly the whole budget is doing something else that has no connection with health. And therefore, and then the governors are treating this budget and even the whole budget in totality that is coming from the national government to the counties, they treat it as personal and private. So, so that there is no moral obligation that they should be careful about misuse and mismanagement of the funds coming from the national government. And then on the side of doctors also, a colleague of mine expressed a concern about the clinics outside the hospitals and the pharmacies outside hospital and in towns, that patients are directed to go and buy medicine, to go and buy whatever they would get from the hospitals. And so there is a collapse of morality on the side of doctors, and then there is also trade attitude and making of money has kicked on our doctors and nurses, such that they no longer want to treat citizens the way they trained or they were trained as doctors and nurses. And so there is a total inhuman or inhumane in their attitudes towards the citizens and everybody. And therefore, making the whole system, when the governor is not in a position to be answerable and responsible for his job as trained, and then the whole system is collapsed because nobody is paid. Even those that are casuals, they are supposed to be paid some amount. Like my county pays people $4,000 a month, $6,000 a month, and then some of those who are better qualified, better paid, must have a relationship with the governor, either a relative or political supporters. And so the whole thing has lost meaning, and it goes down to when there is a gross mismanagement nationally and all over, why shouldn't there be an action taken even on one county government so that it becomes a lesson for the others? But because we go as senators and find findings, and then what do we do? Even if, the best report has been given, but what do we do? What is the plan of action? What is the next step after the report being given? So that is what is left, and therefore, because no governor has been punished or have been made to answer, therefore, they just continue with the mismanagement, with the rogue attitude that is collapsing the whole system of health as far as counties are concerned. And so people wish it would go back like it was. And so while we are happy that devolving of these activities have gone near the people, but those who are managing it are not properly doing what they are supposed to do, so that it makes the services better on the people and in the levels that are supposed to be near the people. Then, on the point of supplies, governors have privatized that part. Like my own county, the spouse of the governor is the supplier. And so she gets paid even without supplying a thing. So you find that there is no milk in the tea because she hasn't paid the supplier. And the supermarkets where maybe she would be taking sugar from, there's no supply because she doesn't pay. So all the supplies, even firewood, nobody brings firewood.